I'm here at the Upper Arlington office of the Columbus Aesthetic and Plastic Surgery office, here with Dr. Susan Vasko. And Dr. Vasko, one of the procedures a lot of people come in for, I imagine still, is a facelift, isn't it?
Yes,
I know that things have come a long way in the aesthetic world, so as far as being invasive, is a facelift still an invasive procedure? Are there different levels now?
The thing that's really changed in the past 10 years or so is the amount of scars that we put on. So in the olden days, the typical facelift scar would start up in the kind of the temple area, go around the ear, go behind the ear, go back into the, we call this the mastoid area, and the short scar facelifts or more mini facelifts have become increasingly popular. One of the advantages is that it kind of becomes more attractive to people maybe in their earlier to mid-50s that aren't really ready for the giant facelift, but are starting to see a little bit going on in looseness in the neck and the jawline, and want to kind of correct things before they get really bad, so to speak.
And is this a good way to do that, to kind of almost stop the aging process a bit?
Well, there's some evidence that having a facelift earlier rather than waiting to you really get very loose actually can prolong the effects.
And exactly what is the recovery like? Because we sometimes still get stuck on picturing maybe the gauze pads all around the face and it being, some kind of long drawn out procedure and recovery. But what is the truth for that?
Well, first of all, recovery-wise, I always tell my patients that you look worse than you feel. So it tends not to be particularly painful recovery. The other thing I tell them is, we get this idea that these mini lifts or weekend facelifts are, you go back to work in a couple of days, but you need to really have a couple of weeks before kind of you have your hair and makeup done, that you're out to be out in public, that you're able to be out in public and not feel self-conscious. So the usual protocol for one of my patients is they have their surgery. The next day we see them in the office, do a dressing change. About day 5, get the first round of sutures out. About day 12, get the second round of sutures out. During that time, I do have them wear a little chin strap to give support to the skin while it's healing. So about 2 weeks out, really kind of good to be out in public, although little bits of swelling going away, even up to 6 months. So I tell them at 2 weeks you're going to look good, a lot better at a month. But you and I will notice a little bit of swelling continuing to go away for even up to 6 months.
So after that period of time, as far as the results are concerned, how long are they going to see those last?
I think of about 10 to 15 years. And what I mean by that is that's how long it takes to get back to where you started. So you're always, be about maybe look 10 years younger than you would have looked if you hadn't had the procedure.
And who would you recommend to come in and maybe get a consultation and to find out if that would be something for them?
The ideal person, first of all, is in good health. So the most important thing really is a nice consultation. I would talk to the patient, see what their goals are, see what, if someone really doesn't have time for recovery, then we might want to look at some of the non-surgical options to try and achieve some goals, but not have downtime.
Okay, Dr. Vasko, thank you so much for your time today.
You're welcome. Thank you.